I'm just going to open with an opening premise, and I think this leads nicely on from Joe's presentation. Should we share the slide?
Yep. All ready to go.
Good. So this diagram is from a blog that I did for the King's Fund in October. So if you go on their website, you can read it. At the end of this session, I might have put you off it, but hopefully not. And really, this is learning from the delivery of NHS Nightingale Northwest, so standing up an organisation in a crisis at speed, but also from learning of standing up a vaccination programme in a crisis. And it talks quite strongly to some of Joe's points. What we found really motivates people. And, you know, Joe talked about intent and how, you know, government might say, well, we should do this, and then expect that people just do it. Actually, it's the mindset piece here that we found is really creating a real driving purpose, a purpose that people can connect to emotionally, that makes sense to them, that they can make meaning from. And if you're able to define that kind of purpose, that enables you then to really drive through, and we've got 3 areas here underneath, how you operate as an organisation. And this is really high level. There's loads of detail under it. I think Joe's given us some really good detail that sits in and around some of this. So everything should be in service of the purpose. If you look at things like mid-staffs and onwards, the inquiries that have taken place, many of the failings that happen within the healthcare organisations is when the governance purpose or the target purpose becomes divorced from the overall purpose. So when target and governance and structure becomes divorced from the purpose of the organisation, bad things happen. So governance and structure should always be in service of the purpose, and it should always enable people. So if you think about things like assurance, risk, quality and safety, and Joe touched on them, always think about, does this serve the purpose? If it doesn't serve the purpose of the organisation, then why are you doing it? And is it enabling your people? And I'll come to that in a second. And the other bit on the right-hand side, which is equally as if, you know, maybe even more important, is how we do things. The behaviours that we have in our organisation, the mindsets, the relationships that we develop, critical, how we include people in the conversations and the roles that we have, and how we include a diverse set of thoughts, ideas and people. How we do that also should be in service of the purpose, and it should enable people. And what am I talking about with people? I'm talking about 3 things. And this is nicked from Dan Pink's, you know, surprising truth about what motivates us. But I've added well-being in. So autonomy, what we found was that when people felt autonomous and felt able to make decisions within understood boundaries, they're not completely autonomous here, people feel good, you know, feel like they can change things around them. They understand what they can change. Mastery, that they get better at stuff, that they develop the skills, and well-being, that we look after people. And if we do that and we enable people to be in service of the purpose, then hopefully good things happen and we deliver good services. So on that point, we're going to focus on 2 areas. We're going to focus on well-being and we're going to focus on inclusion, to just show you how we've done some of that. We can talk about the other pieces, but those were the pieces that we thought are really critical and important at the moment. So I'll hand over to Sheni, who's going to take you through how we did some of the well-being stuff in the Nightingale, but beyond the Nightingale into the Greater Manchester system.
Yeah, thanks, John. Okay, so what we have here is, I'm just going to move us along. Just to start off with the story about how we related this to the Nightingale and the setup. As many of you know, we had a really short period of time to be able to pull together essentially a pop-up hospital in a conference centre, and we had to do a number of things at pace. And our kind of phrase at the time that we spoke about a lot was we were moving at sprint kind of paces and really looking at that marathon. What we wanted to do is create an entire culture that captured everybody who walked onto the site. So we absolutely took a one-team approach. And we knew that very early on, because it's actually a year to the day that all the work started. So it was the 23rd last year. We had people who were coming from all across the system who didn't necessarily know what the ask was, what the job was, but were willing to step up and do their bit. So we had a number of kind of key things that we needed to do, and we needed to do them really, really quickly. As a team, as the culture team on site, we absolutely embedded wellbeing and inclusion at the heart of that, and really wanted to make sure that it was real time, it was relevant, and it really connected with people and had traction. So our people approach, how we actually translated that on site was we had a really clear purpose. And when John talks about purpose, our purpose was absolutely clear. It was about saving lives. We surrounded that with 4 enablers, 4 values. So how we supported each other through that process. So whether you were the security who kept us safe in the building, the doctor, the healthcare assistant, the people who did the catering, absolutely everybody kind of supported each other and really built an approach that really responded to that one team. We trusted each other and our expertises that came from each of those spaces, and we acted. So when we saw something that needed to be developed, we were building those processes right from the beginning. Everybody stood up, everybody had autonomy to be able to go, I think we could try it like this, and were given the space to be able to do that within the safety and the space of working in that one team. And we showed respect as well. Every single person contributed to keeping that mission and that purpose real. And it really helped us all anchor ourselves on what is it that we're here to do. For those of us who are absolutely steeped in that kind of people plan, that national people plan, which was emerging at the same time, this is how it translated. So there's lots and lots of detail underneath those 4 areas, which are the new ways to work, growing for the future, but really key, it was about the belonging and the looking after our people. Within about 7 days, we had a process and a series of offers that we knew were going to respond to what was needed on site. From a wellbeing perspective, we had a 3-tier approach. We wanted to really be fundamentally preventative in this approach. Make sure that people felt cared for, that they felt belonging, that they felt like they belonged, and were able to step up into the work that they were doing. The active support was around the actions and the activities that we took on site, and responding to need was when we saw something happening, when we knew that we needed an intervention, we not only supported those individuals, but the people around them as well. So it was just as much about supporting the capacity and enabling our colleagues. And we broke wellbeing down into 3 areas: the psychological, the physical, and the practical. And you've got a photo there of one of our colleagues who was part of our site team, infrastructure team, with a bike, because at that time, public transport had stopped. We needed to get people practically to their 6 a.m. shifts, and were able to work with Transport for Greater Manchester to be able to put some of that support and provision in place to make sure that when they came and did their 8 to 12 hour, whatever it was, shift, that we were helping them be the best that they could be in their job. We ran lots of activities, and we created a family in a really quick and short period of time. Everybody relied on everyone had a sense of a great sense of responsibility towards each other, and that shared purpose really anchored all of us together. So what does that matter? Why does that really matter? Well, some of the key things that we learned out of that process were really important, because it gave us the fact that we built this culture right from the beginning, gave us the opportunity to almost start with that blank sheet. So we weren't having to undo any of those cultures, undo any of those myths and processes that already existed. We could start with a clean slate right from the beginning. So we knew and we understood what those kind of structures and hierarchies were like, and how people could really be visible and navigate through that. That vision that we had, that mission of saving lives with the 4 values around it, everyone owned it. If you ask anyone across that site, people were able to talk about it. So Helen spoke earlier on about keeping things simple. This was about as simple as it could be. It was a 2-page document. People were able to take it on board, and were able to practically translate that into the work that they were doing. That value of that culture was really important, as was the authentic approach, so people felt safe and looked after. So where we might not have all the answers, where we might not have got it right all the time, what we were able to do was respond in a really inclusive, intentional way that kept everyone engaged through that process. And just as important, we had people who already existed in the NHS and people who were new to the health and care services. So we were able to kind of create a good, positive working culture about what good work looks like. So we've taken all of that learning from that first phase at the Nightingale, and we aligned it and really kind of anchored it to what our challenges were in that broader COVID picture. So we know that COVID created the urgent need for a focus on wellbeing. I don't think I've ever heard as much focus on wellbeing in the workplace as I have over the last 12 months. But what we also saw was really clear evidence around the disparities and the variation, both on the impact of the pandemic on people, as well as the services that were out there across our footprint. So, for example, if you were working in an acute setting, you were more likely to have on-site support, access to wobble rooms, physical spaces, people who were able to drop in and check, as opposed to if you were working in the community, keeping our primary care going, or if you're working in domiciliary care, or whatever that might look like. So we were really mindful of some of those disparities, which meant that people had varying experiences of their wellbeing support, especially when they're working in multidisciplinary teams in place. And again, really key and really important. We had the National People Plan, which I've kind of mentioned, and that was translated into the Greater Manchester People Plan, which really highlighted the need for wellbeing as one of those priority actions at system level. And that's translated all the way through. So at the moment where we're talking about recovery, and there's a switching on services, operational recovery, that people recovery within that is really key. So wellbeing for all of us, we know, and you'll recognise this, you know, we've continued to concentrate on the physical, the practical and the psychological, because it really looks at that rounded approach to how we make sure that people are looked after, they're supported to be their best, both at work and at home. And Juliet in her opening mentioned that this isn't just about what we do within the frame of work. This has really impacted on people's lives in I am going to use the unprecedented word, but in an unprecedented way. And we know what good working cultures look like. We know that it's when people are recognised, when they're seen, when they have that psychological safety, when they feel like they belong and are able to contribute and have the permissions to be able to participate. So we've taken all of that, we've done a huge amount of work across the entire health and care system, and we've created an open source toolkit, a wellbeing toolkit that brings together all the practice, all the learning, all the guides, all the really key practical things that we know that we've come across this 1 year journey. And it launches tomorrow, so it's hot off the press at the moment. And we've broken it down into 3 areas. Those areas which support people to really take that preventative approach. How do you look after yourself? What are the really key practical tools and tips that you can put into place? Supporting others is very much about whether it be a supportive peer, but more importantly, how do we support our managers and our team leaders to really engage and create and support that culture, who are also being subject to all the pressures that we're talking about as well. So some really key practical things in the toolkit. And then the responding to need. So for anybody who's worked in our footprint and our space, there are a significant number of offers out there, and people have described it as a tsunami, to the point where you don't actually know where to go and how to access some of this stuff. So we've curated all of that in a way that's relevant to the footprint that we work across. We've made sure that there's parity and equity across how people can access it. So if you work in our social care, our care homes, if you work in our VCSE kind of sector, if you work in primary care, if you work in our hospitals, you are able to access some of this in a really clear way. And that's really important because if we're able to really embed and support that wellbeing, it's critical that we do that in a concise way. So I thought I'd drop in some images, because who wants to read a lot of text? So these are some of the samples of some of the practical kind of one-pagers and guides that we've got. So everything around finding motivation and purpose, practical things around how do we check in and check out with each other every day, how we deal with our anxiety and control, and talk about kind of what we are able to impact on change, and those things that we might not be able to do something immediately about, setting up buddy systems, dealing with stress. And as I mentioned a few moments ago, really kind of looking at that guide for managers and that support. So with good conversations, really based on a coaching culture, and some templates, because not all of our colleagues across the system have robust HR or OD support. So we're just trying to make sure that we've got some consistency across the footprint. So the key critical learning that we've got from this overall, and that we're taking forward absolutely, is we absolutely need to have an awareness and that equitable access to all the wellbeing services that we've got. And this is really not only just the direct response to the pandemic, but that ongoing recovery that we're just about to step into. And it feels like we've got a long way to go still until we get to the end of this process. We know that we've got variation across our workforce ecology. So everything from what that kind of intervention support might look like, but how we talk about wellbeing, where it sits in our cultures, and how we've embedded that as a practice that isn't an afterthought, and put there, really making sure that we don't leave anyone behind. There is lots and lots of work. We're working in a very crowded space at the moment. So learn from others, be generous, share the work that we're doing, be kind, and make sure that as a system we move everyone forward so we can collectively really look at what those good wellbeing cultures look like, and genuinely have a one-team approach to how we start addressing some of those health inequalities across our system and supporting that workforce. And then we've got a number of future developments. So in the past few weeks, we've had that shift in language and focus. So we are talking about what that recovery looks like, whether that be the operational tactical recovery, but really importantly, that people recovery, because it's the people who have been working for that last year who are going to be taking some of this forward. We've been talking about the future of workplace, so what that might look like. And we do really need to kind of think about that continuum of working differently. So we've got a number of people who've been working from home, working remotely, and that might translate into flexible working. Some people might want to go back to the office, other people might not. Some people might remain on the front line. So there's something about, it's not a return to where we were before, but really designing and curating what our future workplace looks like, and making sure that it's reflective and fit for the work that we want to take forward. And some of those leadership behaviours as well. So, and that's not leadership with a big L, although it does have a capital there. It is leadership that we all take forward and how we can really put that into place in terms of the behaviours. So there's some brilliant work that's been done by our colleagues at the Leadership Academy around the Healthier Leadership Framework, which I think there's a masterclass this Friday, if I'm not mistaken. So there's lots of great work going on across the footprint, and how we curate and collate all of that is really important. I just wanted to finish on a quick quote before I hand over to John. When a flower doesn't bloom, we fix the environment that it grows in, and not the flower itself. And it's really important that it is about that cultural wraparound that we need to start paying attention to that, as opposed to really looking at the work that we focus on the individual rather than the system.